And it's a routine test at most doctors' offices, but now a government task force says it may not need to be.
The panel is proposing new guidelines for vitamin D screening. CBS 2's Dr. Max Gomez is here with more on why many doctors still believe that vitamin D supplements still important for good health. Right, Dr. Max?
That's right, Christine and Diane. You know, normally our bodies make all the vitamin D we need by being out in the sun. Except we're told to avoid the sun and use sunscreen to prevent skin cancer. So we don't get enough vitamin D, especially during the winter. That's why many doctors say we're deficient. Or are we? Screening for vitamin D deficiency has become routine in recent years, but the U.S. Preventive Services Task Force is calling that practice into question for healthy adults.
We really just don't have enough evidence to say one way or the other whether screening for vitamin D deficiency has a health benefit.
Vitamin D is a nutrient that helps the body absorb calcium for healthy bones. The greatest source is sun exposure. It's also found in fatty fish like salmon. The panel agrees vitamin D is important, but just how much is needed is unclear.
What we don't know is exactly what levels really would classify someone as being deficient in vitamin D.
But the task force does recommend discussing screening with your doctor if you show symptoms of being vitamin D deficient. 30-year-old Sakina Ali takes vitamin D for her rheumatoid arthritis because it helps relieve her joint pain.
When my doctor notices I'm really low in vitamin D, she'll prescribe an extra dose.
Her rheumatologist says the task force is allowing doctors to make their own judgment calls.
The decision is therefore mine, individually making a decision on a case-by-case basis.
And many experts say while most people aren't so deficient in vitamin D they break bones or have rickets, they still don't have enough for optimum health. And many studies suggest vitamin D is an important immune system booster that may help fight cancer and improve
heart function, asthma, multiple sclerosis, certain gynecologic conditions, a broad range of disorders that really affect most of us.
Many medical experts say that taking 1,000 or 2,000 units of vitamin D3, the pills are really tiny, is a safe amount and could be essential for good health. And because vitamin D is a fat-soluble vitamin, you can actually take that dose all at once a week.